we had protocols that were binary in terms of what could happen if somebody deteriorated. And if they weren't going to be actively treated and put on ventilators, then they were to be given end-of-life medication. Now, it doesn't mean that everybody in a care home with COVID ended up on end-of-life medication. And there would have been some for whom that would have been appropriate because they were going to die. But it seems that there is a bigger middle portion here than I had appreciated at first, because there are so many people who've been telling stories about their loved ones who, under other circumstances, would have been treated very differently, and who, for lack of visitors, which was a big deal, did not have the support and care they normally would have had, and were being given these drugs, which are very powerful and dangerous, and which palliative care experts were calling out in May 2020, because these protocols were very explicit about how you accelerated the drug, but said nothing about winding it down. And these drugs suppress the respiratory drive. So where they have a great usage in end-of-life care when you've got cancer, it's a different story when you've got an acute respiratory infection, and the drive to breathe is incredibly important in terms of survival.
Yeah, so you got... Sorry,
I'm just thinking, so essentially you're saying that really quite large cohorts of people were being murdered. I mean, honestly, that's the way it sounds to me.
So I think that's really, really difficult term to be using.
Yeah, sorry.
And I don't think that the people who were giving out these medications had any ill intent. Mm-hmm. I genuinely don't think there was any ill intent in what they were doing. It was how these decisions were being made is the problem. So first of all, you've got people who, the doctors, were giving out these prescriptions beforehand, getting people already ready for lockdown, and then were very much practicing at a distance at the other end of a phone. And so people who were making the decisions about the likelihood of living or dying did not necessarily have the expertise to be doing that.